So I'm excited and proud to introduce the next speaker. In the spirit of accelerating practice, the next speaker is a social medicine practitioner who has contributed immensely to developing a health system that effectively address the disease burden, not in resource-poor settings. She's the Chief Medical Officer of Partners in Health and also a professor at Harvard University. Let's put our hands together for Joia Mukherjee.
So it's 10 after 9, and I have a half an hour, or is that right? Or do we have a timekeeper?
Yes, I have.
Okay. So, okay. Terrific. Thank you. Thank you all so much for being here. It's really an honor to be with so many friends and colleagues. Some of you know that we had 2 days of a really wonderful social medicine consortium meeting. There were, I think, fully 80 or 90 of us who were together and really tumbling many of the important ideas of social medicine. You cannot separate peace from freedom. No one can be at peace unless he has freedom. These are the words of Malcolm X, for whom this college is named. Yet across the world, health inequalities are a prison, a type of mass incarceration that relegates more than 1 billion people on our planet to pain, suffering, and the brutal cycle of poverty and ill health. As medical professionals who are awake, we must revolt. As Dr. Frantz Fanon said, it is not about reform or improvement. The system is broken. We must revolt and act aggressively against the status quo. The status quo is this: 1, that a biomedical model that pretends that illness is purely of a scientific nature and is devoid of history and of the active social forces that starve, choke, isolate, shoot, and kill the people we care about and love, is the reality. It is not a biomedical model. It is a biosocial, active forces that are killing people. The second part of the status quo is that those bottom 1 billion people who suffer and die in the prison of ill health and poverty are responsible. That our intervention should be about teaching people to live better lives, about teaching a man to fish when he has no net and his boats have been sunk. These are the pillars of the status quo that we must revolt against. For us, social medicine is the practice of liberation, of standing in solidarity with the oppressed. It is about delivery of care that is rooted in the understanding of these social forces. It is about fighting for equity and knowing that even if we reach a 90% rate of vaccination, of coverage, it is in the 10% of people who do not have care that we find the pain and the suffering. We must fight for equity. And in seeking justice, we have to be mindful of the history and the social forces, the politics of racism, of sexism, and all of the other forms of oppression that have created this massively unequal and unfair situation. For 2 days, we have laughed and wrestled and fought and talked and discussed about the principles of social medicine and our responsibility in the struggle. What is the nature of our responsibility? So I will give you an example of the principles that we seek to build as a consortium across the world, from Zimbabwe to Navajo, from Haiti to Uganda, that we seek to build as a consortium. And I'm going to use the example of cholera in Haiti, and it's not just because you're here, Brian. We will be hearing more from Brian Kincannon later about our fight and our struggle, which is a collective struggle. When cholera came to Haiti, I was in Boston And my good friend, Patrick Almazor, a Haitian physician, on October 19th of 2010, he called me and he said, Joia, something is going on here in St. Mark, Haiti. There are suddenly in front of our eyes adults dying of diarrhea. This has not happened. Even in very poor countries, children sometimes die of diarrhea, which is unjust. That is a prison. But we rarely see adults die of acute diarrhea. Why would he even see that? Because we had already built a delivery system. Throughout Haiti, people were dying in their homes, unnoticed by any medical professionals. But we had a hospital that had been in functioning operation for at least 5 years, because before that, the government of Haiti had no resources to even open those doors properly. We would often, in 2005, go on rounds in the hospital. We called it the morgue. And we would find dead people in their beds on rounds because there were no night shift, there were no medicines. The barriers, the payment to get in the doors were high, but after 5 years of accompaniment and delivery, we were able to provide at least dignified care. So on the first night of the unfolding cholera epidemic, we saw that there was something happening here. And when we started to trace back, and some of our colleagues actually walked with the patients to understand what had happened, we saw, of course, that everyone got their water from the river. It is 2010. Why is anyone getting their water from the river? The social determinants are social forces that accept a level of inequality and racism that is just, frankly, unacceptable. So understanding the social determinants is a principle of social medicine, but mitigating those social forces and social determinants is principle one. Second is, what is the nature of our responsibility for advocacy of an equity agenda? When those patients started coming in with cholera, the world said, teach people to wash their hands. Teach people to wash their hands when they have no running water, when the idea of buying soap versus a cup of rice is a daily problem. There is no understanding of that, so we have to advocate for what? Reality. Advocate for treatment. Advocate for clean water. Advocate for justice. And advocacy, if we are practitioners of social medicine, must be our job. Speaking truth to power. We also found that the reason for the cholera was dumping raw sewage from the UN forces camp into the river where people got their water. Someone must be held responsible. And there was no responsibility assigned. The third principle then is interdisciplinary work. Because how would we even know how to hold someone responsible? We work with a wonderful set of lawyers and advocates throughout the world to teach us about the legal framework of responsibility. We work with social workers who can help us find the most vulnerable. Indeed, one of the first people who suffered from cholera was a mentally ill person. Some of the first victims of cholera were in the prison system in Mirbalais. Without our wonderful connection with social work, with lawyers, with people who are looking at and understanding the social context, we would not be able to revolt and fight back. The third part is deep understanding of the local context. In Haiti, in 2000, the US, under the presidency of George W. Bush, embargoed all aid from Haiti. They stopped loans coming from the Inter-America Development Bank to Haiti in 2000. Why? Because there were some flawed, quote-unquote, flawed elections. That was the same year, by the way, that our elections were the butterfly ballot, the hanging chads for Pat Buchanan. The unsuspecting progressives in Palm Beach, Florida, who voted for Pat Buchanan. So the same year, but we are withholding needed aid. So we worked with advocates, with lawyers, again, social workers, nurses, public health professionals, to actually look at what happened because of the withholding of those loans. And what we found, working in communities, really deeply understanding the social context, is that certain projects were slated for wells, for proper municipal water supply. And those projects were withheld because of the politics of the United States against the government of Haiti. Those politics have direct consequences. One of the main water projects that was not done was in the city of St. Mark, where 10 years later, we saw the ravaging of the population by cholera. Understanding that 10 years, and understanding the 200 years before that, and understanding the economic oppression of Haiti is a way we understand the struggles today. We cannot just say, wash your hands. Because that means we are all washing our hands of the responsibility of history and social forces that are oppressing people. Lastly, our consortium has said we value, we honor, we seek the voice and the vote of the affected. What does that mean? That means people have a say. It's not me as an expert going with my poster and saying, wash your hands. It's about me saying, tell me about your struggle. What is it that I can do with the technical knowledge that I have to help you in the struggles that you have? What can you teach me about your journey to get water every day that I can somehow make easier? And that listening to the voice and the vote of the patient is how we design interventions that truly take into account the social context, the social norms. That's where we start to approach the biosocial model of medicine. So understanding and mitigating social determinants, advocacy, and an equity agenda. How do we raise our voices for justice? How do we work interdisciplinarily across cultures and disciplines and leverage the expertise, whether it's a mother in the community with deep expertise on how she gets her water, to a lawyer sitting in Boston with deep expertise about international law? How do we bring this interdisciplinary group together? How do we really hold ourselves accountable for deep understanding of the context, of the history, of the politics, of racism, of sexism, of international disparities between and within countries? And then how do we honor the voice and the vote of the patient? Today, cholera is still in Haiti, 7 years after that first outbreak. It has claimed at least 9,000 people in its wake. And there are some estimates that it may be 10 times more than that. And I believe those estimates because I know that the vast majority of Haitians do not have daily access to medical care, die in isolation and alone, suffer without the benefits of modern medical care, live in what would be the 18th century in terms of the fruits of science. And so this epidemic, which was caused by international forces, dumping sewage into a river where people shouldn't be drinking from the river because from a justice standpoint, they should be able to turn on a tap. This massive inequality is incarcerating 1 billion people in health inequity. We can look at numerous examples from cholera to AIDS to mental illness, and it is all within this context of understanding the social determinants, fighting for equity, really working interdisciplinarily, understanding the local and global context. How did this happen? Without understanding colonialism and slavery and political forces and the Cold War, you cannot understand what is happening in the world. I noticed a book outside, Neoliberal Chicago. If you don't understand neoliberalism, you will not understand where we are today. So I would urge you to read Neoliberal Chicago, even though I have not read it, but I teach and read a lot and write a lot about neoliberalism. Shout out to a book I've never read. So we're at a moment that the world is waiting for our action. All of us have power. All of us have power to be here today. We have power that isn't the grinding poverty that many face, who would not be able to be sitting in a lecture hall, who are tending their farms, who are sweeping the floors, who are cleaning toilets. We have power in our freedom. But we cannot be truly free when our brothers and sisters are profoundly oppressed, and health inequities is one profound part of their oppression. So last year, when we met as a social medicine consortium, we had a wonderful time. We talked about all of the important elements. We talked about deep listening. We talked about walking together. We talked about many of the affective things that we wanted to bring to social medicine and this new movement that is part of a long historical movement of social medicine. But now, the listening is over. Listening to each other, we still have to listen to the affected. We need to act. We are at a moment in the world where the climate is causing the earth to implode. We see that as a profound health risk, particularly for poor people. This will not be equally meted out. Even though we live on one world, we do not share the resources equally, as we all know. We are closer than we've been in many decades to nuclear war. And we have a very profoundly militarized power in the hands of a very unstable person. So we with power, and there are differentials of power in this room, but we with power have to act. So I have asked a few of us to pledge our action. If you haven't yet, please sign the consensus statement on social medicine as a way to act, and when you sign the pledge, it will ask you for an action. Do something, please. How many people have picked up a protest sign in the last 2 months? How many people had never picked up a protest sign? Yeah, I mean, there are some new people to the movement. Protest, stand in solidarity, fight for equity, understand the social determinants. And so I have asked us, a few of us from the Social Medicine Consortium, to talk about what they pledged to do. I'm going to teach you a little bit of a song so we can rally the troops here. And it goes like this. The world is waiting for our action. The world is waiting for our action. The world is waiting for our action. Brothers and sisters, come. Now you try it. The world is waiting for our action. The world is waiting for our action. The world is waiting for our action. Brothers and sisters, come. So now I'm going to call on my friends and colleagues for their pledges. And after each pledge, I want you to say, brothers and sisters, come, as a promise that we're in this together. Yuri from Haiti, please stand up. He's way in the back. Go ahead.
I will fight for better hospitals.
I will fight for better hospitals. Brothers and sisters, come. All right, Alex from Uganda.
I will build a social medicine movement for healthcare professionals.
I will build a social medicine movement. Brothers and sisters, come. Katie from the United States.
I will work to diversify medicine in the United States.
I will work to diversify medicine. Brothers and sisters, come. Edgar from Zimbabwe.
I will be the voice of the voiceless people.
I will be a voice for the voiceless people. Brothers and sisters, come. Hugo from Mexico.
I will stand on the side of the poor and the marginalized.
I will stand on the side of the poor and marginalized. Brothers and sisters, come. The world is waiting for our action. The world is waiting for our action. The world is waiting for our action. Yo! Brothers and sisters, come. Great. Thank you.
Wow, quite amazing. The world is really waiting for our action, brothers and sisters. And that was an amazing call to action, Joia. I really appreciate, and especially your passion for addressing health inequalities and for fighting for social justice and health equity. It's an honor, and you're a great asset to the Social Medicine Consortium. Thank you so much.